So Jenna, thank you for meeting with me today. I just want to mention that this isn't, as you know, we're not end of rotation, so this isn't a performance evaluation. But I needed to talk to you about some concerns that I had about something I've noticed over the last couple weeks on the team.
Okay.
So what I've noticed is that you have made some decisions on your own that actually, in retrospect, really weren't the best decisions for the patient. And I'm concerned that you're making decisions without getting the help that you need. I mean, as you know, there's so many of us around. So something I've noticed wasn't once or twice, it's been more than that. And I'm wondering, I'm concerned about it. I'm wondering how you see this.
I'm kind of confused by what you're even talking about. I feel like I'm really trying to do what's best for the patients. And sometimes, the junior residents and the team, they're just taking so long to round that I just am kind of forced into making decisions on my own. And I'm trying to do what's best for the patients. Because if I don't make the decision, then we're delaying care.
So first of all, I do know that you care about patients. And of course, you're absolutely trying to make the right decision. So I really appreciate that. And you're working very hard. I think what's happening, though, is, and we can explore a little bit more about why, is the decisions you're making are really not the right medical decisions. So we have to start from your understanding that and then work back to, so you're saying you're having this problem because you can't get the help you need. Is that what I'm hearing?
Yeah, I guess, but who's pointing this out to you? I feel like I'm working well within the team. Does the team think that I'm not working well with them?
It's not about that, and it doesn't really matter where it came from, but I've actually observed it as well. I think what we're concerned about is, just think of it this way. This is a learning opportunity that there's some decisions that you've made, though with the best idea in mind, weren't really the right decisions. And what we're here for is, of course, this is why you have a team, is we're here to help you make decisions that are in the best interest of the patient. And you are not, you're just you're a junior resident. So there are going to be times when what you think might be the right thing to do isn't. And I think that's been happening, but you haven't actually checked with the people around you who are there to support you. You're working very hard, but you need to have the supervision and the support so that at the end of the day, the patient gets the best care. And that isn't happening all the time. So I'm just wondering, again, what you think. Tell me what happens when you are struggling with what to do for a patient, and you don't actually ask for help. What goes on with you? Why is that not happening?
I think it's mostly because the rest of the team's just busy, So I'm just trying to act with the information I see at hand, and rather than just bother someone else with another problem, I feel like I might as well just go ahead and act on my own.
So actually that idea of, not bothering people, that's very, very common for all of us. I think we're sort of trained to, get the work done and not stress the rest of the team. So I think that's a wonderful thought. I think, though, in practice, in these situations, that's what they're there for, and they're more than happy to help. I'm available, but so are your more senior residents. So I think that, an emergency, yes, sometimes you can't get the help, but I think we're not talking about those situations. So I think, again, that really what you need to know is that people are there for you. This is why we have all these layers, really, of help. So it's not about you're not trying or being competent. It's about you just don't have the experience yet. So I'd love you to err on the side of just ask.
Okay. I guess I can give that a try and see how it works.
I think that'd be great. And also, I'm here. And if you find that people are giving you any pushback about that or feeling bothered or acting bothered, obviously let me know. I don't think that'll be the case because I know everybody wants to support each other, and they've all been in your position. Mm-hmm. We've all been in your position. So that's great. And I appreciate your hearing this. I know, you're really working hard. So it's hard to sometimes hear anything that might be critical, but this is really, I'm here for you and to help you learn and give the best care to patients.
Okay.
Thank you. So what we were trying to demonstrate in giving feedback to Jenna was what we call frame-based feedback. And the concept of that is, first of all, when you're sitting down with a person, to set the context so that she knows this isn't, again, an evaluation and doesn't feel like we're just speaking about all of her. And I think it helps ground somebody to understand that we're not judging all of who they are. It's not an evaluation. This is feedback about some specific concerning issues. And then right after that, leading into what the concerns are. It's very tempting to dance around a bit about the problem, and it is hard to stay it straight off, but I think it's the best way to be direct, to tell the person, this is what we're seeing. So we're stating the concerns, and in this case, the behaviors, which is her not asking for help, and then why that's concerning, which is that the decisions aren't actually the right decisions at times. And then that's the first step of the algorithm. And the second step is to then ask her where she's coming from. Why does she think this is happening? What's her view about the situation? And that's eliciting her frame. And in this case, her frame was that she was a bit defensive, which is she didn't want to own this, and that's very understandable, but just persisting with the person and coming back to why we do need to talk about this, and that was around patient care issues, and then asking her again, tell me what it is that would stop you from getting the help that is there and available for you. And then she came to explain that she feels like the rest of the team might be too busy, or they are too busy, and she doesn't want to bother them. So once we understand, or once I understood where she's coming from, that is what her frame is, then the third part of the algorithm is actually lead the discussion around her frame. So she may have had another reason she didn't ask for help, but in this case, it was not wanting to bother the team, which is not a bad reason. It's totally understandable. And then we can try to talk with her about what she can do in those moments and reassure her that it's actually not a bother for the team. The other thing I said to her was, if for some reason you get any pushback, that is that people act like that she's bothering them if she asks for help, then that's a different story, and I'd want her to be open to coming to me, because what we don't want to have is any barriers to her actually asking for help. She didn't indicate that that was a problem, but I wanted to leave it open for her so that if it wasn't working out for some reason, she could come to me and we could problem solve together. You'll notice with frame-based feedback that the context is discussed initially, and so are the specific behaviors and why they're of concern. And that actually goes counter to some of what I think we've been taught, which is that whenever we're going to give feedback, we're supposed to first start out with asking the learner or the feedback receiver what they think is going on. And though that technique of asking first and then eliciting their viewpoint is very effective in certain situations. For example, a end of rotation evaluation, or even discussing a full clinic day. What does the person think went well? What does she think she could do better next time? But with frame-based feedback, in this specific, very upfront way of stating the concerns, that's actually ideal for when you have some critical feedback or even specific positive feedback to give. It's not applicable to every situation, but it is to much more of the formative day-to-day interactions that we may have where things didn't go as well as we'd all hoped. I want to acknowledge the leaders in the Center for Medical Simulation with whom we work collaboratively to develop this frame-based feedback algorithm.